be a really inclusive Ireland and to be inclusive of all groups, including Roma and travellers, we really need to understand the challenges that they face on a daily basis with interacting with all of the services around Ireland, including education, including Intero, including the hospital service, including all of the wraparound services, that there are huge challenges and a lot more awareness around that is needed.
Evidence shows the traveller community has the lowest life expectancy, highest suicide rates, poor mental health and lowest educational and employment rates in Ireland compared to their settled counterparts. How can we improve this? By working together with organisations and frontline staff in solidarity, we can make Ireland a more inclusive island for all.
Travellers are more than 7 times more likely to die by suicide, and more are dying every day. The one change that would make most benefit in our community is funding for travellers to become mental health support workers, as the mental health system isn't working.
1 in 5 workers is aged 55 or older, and many are past 65. Older workers have the same rights as every other worker, and those rights must be respected. Age does not predict capacity to work. Older workers also have experience, better stress management and intrinsic motivation to work. Older workers need equal access to training, and Ireland should follow the example of Australia, Canada and New Zealand and ban mandatory retirement.
As an Afghan refugee, having a local experience, independent, intercultural community organization made me feel safe, respected and supported as I adjust to life in here. So according to me, there still need to be more CIDP organizations like this all over the country.
I wish to see all Muslim women in Ireland can speak English fluently and manage their day-to-day activity without any need to depend on anyone else. I wish to see them more confident, more empowered, in more important positions like a TD or a mayor.
If you wanted to change one thing, you'd have to change the minds of the people that we're trying to talk to. You have to get them to ask themselves, am I disabled? To take it on board what it is like to live a life where things are not as accessible to you as they might be now.
I am a disabled activist. 2 of the greatest changes that I'd like to see in this country is an increase in inclusion for people with disabilities and co-creation of government policy. I think these 2 issues need addressing and are very close to my heart.
So we need people who are in positions of power and have access to the resources to actually use political will to ensure that that benefits the social inclusion of disabled people.
So the CRPD encapsulates the social model of disability, and I think if we could communicate the social model of disability to policymakers and to the general public, we'd really be getting somewhere. That's an idea that we're not disabled by our impairments, but we're disabled by the barriers that we encounter in our society that stop us having full inclusion.
My hope for the future is that I would like to see Sláinte Care fully implemented and better use of primary care centres to assist and remove the need for long hospital journeys where blood tests, x-rays and other medical episodes could be done in the primary care centres.
As a trans man and a migrant, seeing the pride flag at the window gave me a sense of relief. When I walked inside, I was welcomed and helped, not only as part of the LGBT+ community, but in many different areas of my life.
Our CDP makes an enormous difference in supporting and engaging the migrant community in our county. We help to build the relationships, and most importantly, to create the conditions for inclusion and equality in our county.
And finally, we live in a society, not in an economy.